live streaming from Growing Smile Congress, and now we are very pleased to host Dr. Sandra Tai. Hello.
Hello. Well, thank you for having me for this interview. I'm so excited to be here.
Thank you, Sandra. Sandra, yesterday you had a great, very interesting lecture on paradigm shifting in early treatment, intercettivo. Is it correct?
Yes, yes. You know, the word paradigm shift, represents a change in the way we think.
Okay, can you explain more?
Well, in the old days, when we saw a child very young, maybe with only some incisors, permanent incisors in front, we would say, we're just going to straighten forefront teeth. All the other problems, we will wait until they turn about 12 in a full permanent dentition to fix all the other problems. The paradigm shift I'm talking about is now we approach malocclusion in a completely different perspective. We will treat the entire malocclusion at a very young age, even in mixed dentition. So the majority of the orthodontic correction is done with a mixture of permanent and permanent. And then, when we create enough space, permanent teeth actually come into better. And when they're in permanent dentition, they only really need a final touch-up to finally restrict the mouth.
It is very nice that yesterday you showed maybe a slide of the website of American orthodontics with 7 years as for kids.
Well, in the light of all the other lectures that have happened this morning, I always feel 7 years is too old. That we should be looking at kids at 3, 4, or 5 years old when they're in the primary dentition. I certainly see problems in the primary dentition, and using the Invisalign First product, I've treated some primary dentitions where we corrected cross bites, where patients are grinding very deep bites or open bites, so that the child can learn how to speak properly. So there's certainly, I think, but at the very minimum, I think the screening should be as early as 7 at the very minimum.
Okay, at least.
At least, yes.
Let's talk about palatal expansion with aligners. Where is the main innovation?
Yeah, this is really revolutionary because it is not an aligner product. It is 3D printed nylon. It's very rigid. And the expansion is built into the appliance, is built on software. So, and then they use a computer simulation to simulate the shape, how the shape of the palate changes as we expand it. So if you pull out expanded from the package, it looks like the patient's palatal shape today. But if you pull out expanded in 32, the shape of the palate actually has changed, and all of this is based on computer modeling.
Okay. How do you monitor the patient in a long term?
In the long term, after the expansion is completed, we will hold the expansion for 3 to 6 months. And this is very standard, no matter what type of palatal expander appliance or practice used. The principle is we have to hold the widened maxilla long enough for the mid-palatal suture to fill up. And then after that, we will follow through with treatment with Invisalign first. And the reason for that is if I have a V-shaped upper arch, when I expand, I just get a bit. How do I change this V shape into a U shape? I have to do dental alveolar development with Invisalign aligners. And so after that, we will hold the patient with aligners, and we actually do it with mild additional aligners that build in a little bit more expansion and eruption to simulate how the child will grow over the next year or two, right after the early intercettivo phase.
Okay. I have a question about our listeners, the dentists that are watching this interview. What do you say to them if they use the aligners at a very basic level? I don't know, just to close diastemas or micro movement?
Well, certainly that is the 25-year-old impression of aligners.
Okay.
So it shocks many people because we still think of aligners as new, but aligners have been around since 1999. And when aligners first came to the market, that was all it was capable of. Even for me, as an early adopter of technology, in the year 2000, 2001, I only treated very simple cases with aligners. Lots of IPR, lots of tipping of the teeth. But today, 25 years later, the technology has evolved so much. We're actually treating the most complex cases now with aligners, and we have the ability to do so. For example, the plastic is different. The attachments are different. And now for the Invisalign system, we have smart force aligner activations, where when we make the alignment, they change the shape of the alignment to exert certain types of forces. For example, to prevent buckle tipping, to expansion. So now we are very in control of alignment. So I would say that if you're one of those who maybe started using aligners some time ago and found that, hey, this wasn't a great product, I would say, try it again. It's a different product. Because think about the smartphones we use today. What type of phone did you have 25 years ago? Well, maybe some of us didn't have phones 25 years ago. We started on the bottom of the brick, the flip phone. Remember when we had to text using an alphanumeric keypad? Mine name begins with the letter S. For S, you have to press the key 4 times to generate the letter S. And now we have a smartphone. So just similarly as cell phone technology has evolved so much in 25 years, aligner technology has also evolved in 25 years.
Okay. Sandra, thank you. Thank you so much for joining us and to have you here with us.
Oh, thank you, Grazie.